Datuk, we were previously told that recovering patients would need to test negative twice before being discharged, with new cases every day. Is that policy still the same, or is there been a reduction?
That was our previous guidelines, but now new guidelines, now you only need to do one test, that is upon discharge on the day 13. So once the day 13 negative, then we allow them to go back.
Just a quick follow-up on that, but there have been patients that kind of have this false negative. Is there a risk?
So that's the reason why we must make sure in terms of sensitivity and specificity of that test. Our PCRs is very high sensitivity and specificity, but if we were to use, for example, rapid test kit, then we must look into the sensitivity and specificity of test kit. During the MCO 1 and 2, the previous guidelines, we did twice, 24 hours apart, at least 24 hours apart. But when we look into it, there is no discrepancy in terms of the data that we have. So now we are confident, because based on the experience from MCO 1 and 2 and those who have been discharged, the two negative is actually coherent. So now we only depends on one.
Have there been any cases of people who have been discharged and then coming back again?
So far we do not have any, but we do know that the question is whether sometimes there's issue of a reinfection. So before we discharge our patient, we continue to counsel them to make sure that they protect themselves, and also because sometimes they thought that they already have the immunity, and then they can actually go out to the public in the community, but they can be infected again. Today, although they have the antibody is not protective. That's the data that we have today. So possibility whether they can be reinfected, yes, because if the antibody is not protective, so they can be reinfected again. Or that means sometimes, as we have discussed before, once we are negative and then they get positive again. Positive is a weak positive. That is actually a residual virus shedding. Because of that, it's a positive. So far we have three cases, if I'm not mistaken, and negative, and they went back. For example, I mentioned the case that we discharged, and the patient went back to Brunei, and Brunei repeated the test again, and it was positive, but it was very weak positive. So it is actually a residual virus shedding rather than a reinfection again.